The Republican plan to repeal Obamacare has failed in the House of Representatives. The signature campaign promise of the president and Republicans everywhere was pulled from the House floor this afternoon when it became clear there were not enough Republicans on board to pass the bill. They didn't have the votes to pass it yesterday either, and the bill has been the subject of intensive lobbying over the last 24 hours. President Trump had given Republicans an ultimatum last night to vote on the bill today, or he would move on to other issues and leave Obamacare in place. Chip Reed is at the Capitol where this story is breaking right now. Chip?
Well, Scott, I'm getting a series of emails from CBS News producers all over the Capitol gathering information, and at first I got word that the bill has been pulled, and then I got word that the bill has been pulled at the request of President Trump, which may be a little bit surprising because it was President Trump who insisted last night that they hold a vote. Then today, when it appeared they did not have the votes, he still insisted that they have a vote. Then he sent Vice President Pence up to the Hill earlier this afternoon to try to convince the Freedom Caucus, very conservative members of the House, and old friends of then Congressman Pence to take another try at it to see if they can vote for the bill to get it through. And apparently they said no again. And now President Trump himself has told Ryan, pull the bill down, don't vote on it. A lot of members don't want to have to vote on a bill that isn't going anywhere, because it could be used again against them politically, and they get nothing positive out of it. Scott?
Chip Reed covering the story for us at the Capitol today. Chip, thank you very much. This was essentially a conflict between conservative Republicans who felt that the Republican replacement of Obamacare did not go far enough, and moderate Republicans who felt that it went too far. Margaret Brennan is at the White House for us now. Margaret, what are you hearing there?
Well, Scott, this is a major about-face for the president, who felt very confident earlier this week, even talking about putting his own name, calling it Trump Care, on this health care overhaul. But now we are hearing it was simply the more conservative branch within his own party that would not get on board. That House Freedom Caucus just wouldn't support, despite all of the arm twisting and all of the sweeteners that the White House had offered to them just in the past few days. It's been an intense round-the-clock effort here to get members on board, and they simply couldn't deliver those votes. This is really, Scott, the first major attempt the president has made essentially at governing, at legislating. Up to this point, all the big efforts have been through executive orders. This is the messy lawmaking process that is really a first attempt by a president without political experience to attempt to govern in this way. And he simply went ahead with a strategy that has worked for him in real estate and in business, which is take it or leave it. You're with me, you're against me, or I'm walking away. And that did not work with lawmakers. Pushing for this vote and saying, put your name here, stand with me, and get this through didn't work at this 11th hour. And you saw that this decision to pull the bill, to cancel the vote and reevaluate is an attempt to help save some face for some Republicans here, instead of having them on the floor stand by their vote. But the president and the White House has made it clear they know who was with them. They have the names of those who were willing to stand with them on a vote that has become increasingly controversial in these past few days. Scott?
Margaret Brennan at the White House for us. We'll undoubtedly be hearing more from the White House as this evening wears on. John Dickerson is our political director and, of course, the anchor of Face the Nation. John, what does this mean to this early point in the presidency?
Well, it means that President Trump, who came to Washington with a big to-do list, he's ticked off some items on that to-do list. In this week, his Supreme Court nominee is sailing through that process. On the one hand, that's going well. On the other hand, he has been dealt two very big blows early in his administration. First, that travel ban, the president running into the other branches of government, in that case, the judiciary. And now he's running into Congress and members of his own party. So what this is a bright line of how much power the president has in his own Republican Party, in his ability to convince against members, and also on the ability of his negotiating power to translate into the political realm. It's one thing to govern, it's one thing to campaign, where you say it's either me or the other person. But when it comes to governing and legislating, it's not usually an A or B choice. There are lots of moving parts. It's quite complicated. And when the president said nobody knew how complicated health care reform was, all the people who've been trying to undo Obamacare for 8 years knew how complicated it was. And he's now learning this painful lesson today as he's had to decide to pull this bill.
John Dickerson for us now. In about 15 minutes at 4 o'clock Eastern Time, the Speaker of the House, Paul Ryan, is expected to hold a news conference to explain what this means and where the Republicans will go from here. We will be back on the air 4 o'clock Eastern Time, 3 o'clock Central Time, live with that news conference. There's going to be much more about all of this on your local news on this CBS station, on our 24-hour streaming news service, CBSN, and of course right here, a full wrap-up tonight on the CBS Evening News. Until then, I'm Scott Pelley, CBS News in New York.